A first-year resident should tremble the first time the scalpel touches skin. But Dr. Emma Carver didn't even blink. In Operating Room 3 at Harborline University Hospital in Baltimore, she moved like a metronome, quiet, exact, unhurried. Her gloved hands were a locksmith's tools, turning panic into clean lines. Dr. Nolan Pierce, the chief of surgery, watched from the corner as Emma tightened a clamp with a tiny twist and the monitor's rhythm steadied as if it had obeyed her. Pierce's eyes narrowed. "Those hands aren't normal," he murmured, almost to himself. "So how does a brand new resident carry herself like someone who has already paid the price for hesitation? Stay to the end and comment the city you're watching from. I love seeing how far these stories travel." Now let me bring you into the world of Harborline. The world of Harborline began long before the first incision. Emma Carver arrived while Baltimore was still rinsing last night's rain off the sidewalks. The lobby smelled like floor wax and burnt coffee. A security guard nodded at her, the way people nod at a stranger they see every day but never really meet. She kept her eyes forward and her pace steady. In the locker room, the other first-year residents moved like sparrows, quick and loud, snapping gloves, laughing too hard at jokes that landed flat. Emma changed in silence. She folded her street clothes into a tight square, set them in the corner of her locker, and checked her pockets twice before closing the door. Phone, badge, pen light. Trauma shears she never used here but never left behind. In the surgical workroom, the morning list glowed on the screen. Gallbladder, hernia, thyroid, 2 add-ons. Ryan Cade leaned back in his chair with the loose confidence of someone who believed the hospital ran on his charm. He had the kind of smile that asked for admiration before he earned it. "Look who's early," he said. "Emma, you sleep here or what?" Emma slid into a seat and opened the chart in front of her. "I like to read." Tessa Quinn glanced up from her notes. Her hair was tied back in a practical knot, her eyes sharp and awake even this early. "She reads," Tessa repeated like she was tasting the words for truth. Ryan smirked. "I read too. Right before exams. Like a normal person." Emma didn't answer. She highlighted a line in the patient's history, then another. "Subtle fever last night. Pain that started vague and settled in the right upper quadrant. Heart rate climbing in the last hour. Not dramatic, just wrong." A scrub nurse pushed a cart past the door, metal rattling softly. Emma's gaze followed the sound without her meaning to. Tessa watched her, not the way people watch a quiet person out of pity, but the way a good clinician watches a monitor. "Looking for pattern," Carver Tessa said. "You always this calm?" Emma capped her pen. "It's early." Tessa's mouth twitched almost a smile. Ryan rolled his eyes and stood. "Come on," he said. "Let's go impress the gods of surgery." In the hallway outside Operating Room 3, the air was cooler. The smell of antiseptic sat on the tongue. A whiteboard listed the case. Darla Simmons, 46, laparoscopic cholecystectomy. The patient lay on the gurney, with her hands folded over the blanket like she was trying to keep herself from shaking. Her eyes flicked between faces, searching for someone who looked certain. Ryan stepped up first, voice smooth. "Ms. Simmons, I'm Dr. Cade. We're going to take good care of you." Emma stood slightly behind him and looked at the patient's lips, the way they pressed tight at the corners. She looked at the small sheen of sweat along the hairline. She listened to the rhythm of the breathing. Too fast, too shallow. She watched the monitor as the nurse wrapped the cuff around the patient's arm. Blood pressure decent, heart rate a little high, oxygen fine. Nothing that would make anyone pause. Emma paused anyway. "Any nausea?" she asked, keeping her tone gentle. Ms. Simmons swallowed. "A little." "Any chills last night?" The patient hesitated. "Yeah. I thought it was the air conditioner." Ryan shot Emma a look, the kind that said, "Stop fishing." Emma didn't bite back. She just nodded, filed it away, and watched the anesthesia team roll in. Inside the operating room, bright lights turned skin pale, and every surface into a mirror. Instruments lined up on the sterile field like silver teeth. The ventilator sighed. The monitor beeped a steady, ordinary beat. Emma scrubbed at the sink with slow precision. Fingertips, between knuckles, under nails. She counted without counting a rhythm that lived in her muscles. When she stepped into her gown, the circulator tied it at the back and said, "You're Emma, Right new. Yes. You move like you've been here a while. Emma held her hands up, elbows bent. I've practiced. The nurse gave her a look that said practice did not explain that. The doors opened again. Dr. Nolan Pierce entered without a rush, but the room shifted around him as if he carried gravity. He didn't waste words. Dr. Cade, you're leading, Pierce said. Dr. Carver, first assist. Ryan's grin widened. Yes, sir. Emma took her place. The drapes went up. The preoperative checklist ran like a litany. Antibiotics confirmed. Consent verified. Timeout completed. Pierce's eyes moved once over the room, then settled on Emma's hands. Not her face. Her hands. Incision, Ryan said. The first cut was small. The skin parted cleanly. Ryan worked quickly, a little too eager. Trocar in, gas on, camera in. The inside of the abdomen bloomed on the screen, glossy organs under harsh light. Ryan narrated as if he was giving a lecture. Standard anatomy. Gallbladder looks inflamed, but manageable. Emma watched the edges. She watched the color, not just inflamed, darker at the fundus. A thin sheen that wasn't just bile. A faint, dirty haze. The monitor beeped again. Heart rate climbed 3 points. The anesthesiologist adjusted a drip. She's a little tacky. Ryan waved a hand. Pain response. Emma didn't speak yet. She leaned in slightly, eyes steady on the screen. The gallbladder wall looked thick, tense, angry. Pierce said nothing. He let Ryan work. Ryan grasped the gallbladder and lifted. A thin stream of fluid seeped where it should not have. Emma caught the smell before it became obvious. Even through her mask, it slipped through sour and metallic, the kind of odor that did not belong in a clean case. Her throat tightened. Her mind did not race. It narrowed. More suction, Emma said quietly. Ryan didn't look at her. We're fine. The suction tip in Emma's hand stayed still for half a second, then moved. She positioned it exactly where the seepage was pooling. She didn't chase. She held. On the monitor, the fluid cleared. Beneath it, the tissue looked worse. Pierce leaned closer, eyes on the screen. Emma heard the ventilator sigh again. The beep continued steady, but slightly faster. Ryan clipped and cauterized with a confidence that bordered on arrogance. He reached for the cystic duct. Emma saw the angle of his instrument. Too shallow. Too close to inflammation. It would slide. It would tear. Ryan, she said low enough that only he could hear. The wall is friable. He flicked his eyes toward her, annoyed. It's fine. Emma didn't argue. She adjusted her retractor. She gave him a cleaner view without making it obvious that she was saving him from himself. When Ryan tugged again, the gallbladder wall tore. A sudden spill. Thick, cloudy bile mixed with pus. The operating room seemed to hold its breath. Damn, Ryan muttered. The scrub tech's eyes widened. That's infected. Pierce's voice cut through the moment, calm and sharp. Control it. Suction. Irrigate. Emma moved before the command finished. Suction on. Tip placed. Fluid cleared. Her left hand steadied the tissue with just enough pressure to avoid further tearing. Her right hand made small, precise corrections like she was guiding the entire field back into order. Ryan's breathing changed. He slowed, finally recognizing that the case had teeth. Pierce watched Emma's hands, then the screen, then her hands again. Convert, Pierce said. We need better exposure. Ryan's shoulders stiffened. We can manage laparoscopic. Pierce didn't raise his voice. He didn't need to. Not if you want her to leave this hospital alive. Emma felt the patient's heart rate bump again. She didn't look away from the screen. She kept her motions economical controlled, as if wasted movement cost something she could not afford. The conversion happened quickly. Incision extended. Retractors placed. The field opened. The smell hit harder now. The infection was not contained. The gallbladder had been simmering, waiting. Necrosis, Pierce said almost to himself. Emma didn't nod. She simply reached for a clamp the instant Pierce's hand opened, like she knew what he needed before he asked. She passed instruments in a sequence that made the work smoother, faster, quieter. Ryan glanced at her with a mix of irritation and something else. Fear, maybe. The kind that came from realizing someone beside you was operating on a different level. They removed the gallbladder in pieces, careful, methodical. Emma's sutures came later, and they came clean. Perfect spacing. Perfect tension. No wasted knots. When it was over and the drapes came down, Ms. Simmons lay stable, breathing in a calm, assisted rhythm. The room exhaled. Ryan peeled off his gloves and tried to laugh. Well, that was fun. No one laughed with him. In the corridor outside, Tessa waited near the sink. She looked at Emma the way she had in the workroom, like she was reading a monitor. That suction placement, Tessa said softly. You didn't hesitate. Emma washed her hands again, even though they were already clean. Water ran over her fingers. It needed to be done. That wasn't the point. Ryan stepped between them, forcing the moment into a joke. She's just intense. Probably watches surgical videos at night like a psychopath. Tessa's eyes narrowed. Videos don't teach that. Ryan scoffed and walked off, shoulders tight. Emma turned away from the sink and found Dr. Pierce standing at the end of the hallway. He wasn't in a hurry. He wasn't angry. He was studying. Emma felt his gaze land on her hands again. The same place he had looked in the operating room. Like the truth was written there in tendons and scars. Dr. Carver Pierce said. His tone held no warmth, but it held intent. Come with me. Emma followed Dr. Pierce down the corridor past double doors that hissed shut behind them. The noise of the operating wing faded into a distant hum. Fluorescent lights washed the hallway in a pale, sleepless glow. Nurses passed with clipboards. A transport tech rolled an empty bed that squeaked at every turn. No one looked up for long, but Emma felt eyes anyway, the quick flicker of curiosity that never stayed innocent for long. Pierce did not walk fast. He walked like time belonged to him. At the end of the hall, he pushed into a stairwell instead of taking the elevator. Emma noticed without commenting. The stairwell smelled like concrete and disinfectant. Her shoes made almost no sound on the steps. Old habits rose in her body, quiet and automatic. Keep your breathing even. Keep your hands still. Give nothing away. Pierce's office sat on the top floor, tucked behind a glass wall that overlooked the main atrium. The room was immaculate. Books lined one shelf in neat rows. Framed diplomas covered the opposite wall with the precision of a museum exhibit. A photo on his desk showed him standing beside a surgical team, all smiles and bright lights, the kind of image hospitals used when they asked donors for money. Pierce closed the door with a soft click and did not invite her to sit. He took off his cap, set it on the desk, and turned to face her. His eyes were sharp in a way that felt clinical, like he was examining a wound. You corrected Dr. Cade without correcting him, Pierce said. Emma blinked once. I assisted. You did more than assist. Emma kept her gaze steady. She chose a spot just below his eyes, close enough to read him, far enough to keep control of her own face. Pierce leaned back against the desk. When the gallbladder tore, you placed suction exactly where the spill would pool. You stabilized the field before the room even reacted. Emma's throat tightened, but her voice stayed level. I saw it happen. Pierce's expression did not change. You anticipated it. Silence settled, not uncomfortable, just heavy. Pierce let it sit there like a weight he expected her to carry. Emma finally said, I pay attention. Pierce's mouth twitched, not a smile, more like recognition of a dodge. Everyone pays attention. Most people still hesitate. Emma felt her pulse in her wrists. She clasped her hands behind her back to keep them from moving. The simplest way to look calm was to be still. Pierce stepped around the desk, slow, deliberate, and picked up her chart folder from a stack. He tapped it once against his palm. Emma Carver, he read aloud as if testing the name. Top scores, strong letters, clean record, no research gaps, no disciplinary notes. He looked up. On paper, you are a dream candidate. Emma let out a small breath. Thank you. Pierce set the folder down. That was not a compliment. Emma did not move. Pierce walked to the window and glanced down at the atrium. People flowed through the lobby in thin streams. Families, patients, staff with coffee in hand. The world looked controlled from up here. I have seen residents like Dr. Cade Pierce said. Bright, loud, certain, sometimes talented, often reckless. Emma's jaw tightened at the mention, but she stayed quiet. And I have seen residents like you, Pierce continued. Quiet, watchful. They survive by staying small. His gaze returned to her. But they do not operate like you do. Emma felt the words land in her chest, like a blunt instrument. She had tried to keep the edges smooth. She had tried to make her competence look like luck and preparation. It had not worked. Pierce moved closer. Not aggressive, just nearer, closing the space, until Emma could smell the faint bite of soap on his hands. "Tell me what you were taught," he said. Emma chose her words carefully. "Standard rotations, skills lab, simulation." Pierce's eyes narrowed. "That is what you were assigned. That is not what you learned." Emma forced a small, polite smile that did not reach her eyes. "I practice. I study. I come in early." Pierce did not blink. "You also tie knots in a pattern I have not seen from a civilian intern in years." Emma's stomach tightened. She could feel the room tilt by a degree just enough to remind her that he was closer to the truth than she wanted. Pierce reached into a drawer and took out a pen. He held it out like a scalpel. "Show me." Emma hesitated for the first time. Not long. A fraction of a second. Then she stepped forward, took the pen, and set it between her fingers. "On the drape," Pierce said. Emma looked at the empty space on his desk. He had placed a sterile blue towel there folded tight. She positioned her hands above it. Her fingers moved without thought. Wrap, cross, cinch, secure. Her hands kept the tension, even the knot flat, clean, decisive. Pierce watched in silence. Emma realized too late that she had not performed like a student demonstrating a skill. She had moved like someone who expected the knot to hold against chaos. She set the pen down. Pierce nodded once, as if he had just confirmed a diagnosis. "You do not tie like you are trying to remember. You tie like you are trying to survive." Emma felt heat creep up her neck. She kept her face neutral. "I want my knots to be reliable." "Everyone wants that," Pierce said. "Very few people are afraid of failure the way your hands are." Emma swallowed. She could taste antiseptic in the back of her throat. Pierce picked up his cap again and rolled it between his fingers. "How many cases have you assisted since you started here?" Emma answered truthfully because it was safer than inventing. "Enough to learn." Pierce's gaze sharpened. "That answer belongs in an interview, not in my office." Emma looked down for a single heartbeat, then back up. "I do not understand what you are asking." Pierce exhaled slowly through his nose. "I am asking where you learn to stay calm when the room goes quiet." Emma's fingers curled slightly. She loosened them. Pierce continued, voice even. "When Dr. Cade tore the wall, most new residents would freeze. You did not. You did not even flinch." Emma kept her voice soft. "I do not like freezing." Pierce stepped to the bookshelf and ran a finger along the spines without looking at them. "I have trained residents for 15 years. I can tell the difference between preparation and experience." He turned. "You have experience," he said. Emma felt the sentence press against her ribs. She had built a version of herself that fit in a residency program. She had filed away the past like a box shoved into the back of a closet. She had practiced smiles. She had practiced normal answers. Pierce took 2 steps toward her. "And it is not just operating," he added. "It is the way you enter a room, the way you scan exits, the way you hold your hands when you are waiting, like you are protecting them." Emma's mouth went dry. She could not stop the reflex of shifting her weight, subtle, balanced, as if the floor under her might change. Pierce saw it. He always saw it. "You have been somewhere that taught you that," he said. Emma forced herself still again. People can be observant without being strange. Pierce's eyes stayed on her. "That is another answer that belongs in an interview." A quiet beat passed. Emma tried a different tactic. "Is this about Dr. Cade?" "If I embarrassed him, that was not my intention." Pierce shook his head once. "This is about you." Emma held his gaze. She kept her breathing slow. She could feel the edge of panic, not loud, not obvious, but there like a hand on a door handle. Pierce's voice lowered, almost careful. "If you are hiding something that affects patient care, I need to know. Not for gossip, not for my ego, because I am responsible for this program, and I will not be surprised in my own operating rooms." Emma's lips parted, then closed. She could tell the truth. She could lie. Either choice felt like stepping into traffic. Pierce watched her weigh it. He did not interrupt. Emma finally said, "I am here to learn." Pierce's eyes hardened. "You are here to become what you already look like." The air in the room felt thinner. Emma's chest tightened. She could feel the urge to deflect, to joke, to disappear. She pushed it down and stood steady. Pierce's pager buzzed on the desk. Once, then again, urgent, insistent. He glanced at it and something shifted in his face. The controlled stillness cracked into motion. A sharp voice burst from the overhead speaker in the hallway outside his door. "Trauma alert. Multiple incoming, all available surgical staff to the emergency department." The words cut through the building like a siren. Pierce grabbed his cap and moved for the door. Emma followed, without thinking, her body already changing gears, her hands already steady at her sides. The elevator doors opened onto noise. Not the usual emergency department noise of phones and footsteps, but something sharper, layered, urgent. A chorus of alarms. Voices calling names that kept getting swallowed by other voices. The smell hit Emma first, even before she saw the first stretcher. Diesel from idling ambulances outside. Wet concrete. Blood fresh and metallic, braided with the harsh sting of antiseptic. Dr. Pierce pushed through the crowd at the nurses' station, his presence clearing a path without him asking for it. "Give me the story." A charge nurse with a headset pressed to one ear turned eyes wide but steady. Light rail derailment near the harbor. Construction equipment on the line. Multiple cars tipped. "We have at least 12 en route 5 critical. More coming." Pierce's jaw tightened. "Trauma bays 1 through 4. Or standby. Call anesthesia. Call radiology. Get blood ready." The department moved like a living machine when he spoke. A respiratory therapist grabbed equipment. A resident sprinted toward supply. Someone shouted for more IV pumps. Emma did not wait for an assignment. She stepped toward the first bay as if she had already been standing there all day. Pierce noticed. "Carver." Emma looked at him, just a glance. "Triage," he said. She nodded once and went. The first stretcher burst through the doors, wheels rattling, paramedics shouting over each other. Male mid-40s, crushed chest, shortness of breath, declining pressure. The patient's face was gray under sweat. His lips had a bluish tint. His eyes were open but unfocused, tracking nothing. Emma's hand landed on his sternum, light enough not to hurt, firm enough to feel the rise. It barely rose. Her other hand checked the neck. Veins stood out full and tense. She leaned close to his mouth. His breath came in thin, desperate pulls. "Airway patent," she said. "Breathing compromised. Trachea looks shifted." A paramedic shook his head. "We tried oxygen, it's not helping." Emma's eyes flicked to the monitor. Heart rate climbing, pressure dropping, oxygen falling like a stone. She looked at his chest again. One side moved less. One side sounded wrong when she listened, like a drum covered in thick cloth. "Tension pneumothorax," Emma said, voice calm. "Needs decompression now." The nurse beside her blinked. "Doctor, we need an order." Emma didn't look away from the patient. "Needle 14 gauge. Now." A tech hesitated. "We have to page the attending." Pierce's voice cut through. "Do it. Bring it." The second stretcher rolled in before the first one even cleared the doorway. A young woman, maybe 20, hair matted with grit hands clutching her abdomen as if she could hold herself together by force. She was trapped, the medic said. Abdominal pain, pale, tacky pressure low. Emma stepped to her side. The woman's skin felt cool. Her eyes were glassy. Her breath shallow. Emma pressed gently into the abdomen and felt the reflexive guarding the rigid wall beneath. The woman flinched, then went still. "Internal bleeding," Emma said. "Possible spleen or liver. Get 2 large bore IVs. Type and cross. Or consult now." A resident standing behind her opened his mouth. Emma turned her head just enough. "Don't argue with the abdomen that boards up like that." "Move." He moved. The third stretcher arrived with a man screaming, leg twisted at an angle that made nurses wince. Bright red blood pulsed through gauze. He was loud, but his pressure held. His eyes tracked. He obeyed commands. Emma assessed fast. Open fracture but stable. Pain control. Antibiotics. Ortho. He can wait behind the bleeders. The man screamed again. Emma met his eyes. I hear you. We'll get you help. Keep breathing with me. His screaming didn't stop, but it changed. It followed her rhythm for a second, then another, as if her voice had given him something to hold. Stretchers kept coming. A teenager with a scalp laceration and dilated pupils. A construction foreman with a pulseless hand and swelling in the forearm. An older woman with wheezing and bruised ribs breathing fast enough to make her dizzy. Emma moved through them like a current, never rushing, never freezing. Every time she spoke, the room sharpened around her. Tourniquet higher, pelvic binder. 2 units now. CT can wait, ultrasound here. Get me a chest tube tray. Rosa Delgado, the ER charge nurse, appeared at Emma's shoulder with a clipboard and a look that said she had seen disasters before. Who are you? Rosa asked, not unkind, just stunned. Emma didn't smile. Helping. Rosa studied her for half a second, then handed her a marker. Mark the triage tags yourself. Saves time. Emma took the marker and wrote, clean fast, decisive. Red, red, yellow, red, yellow, green. 1 black tag that made her hand tighten for a beat before she let it go. The first patient with the crushed chest suddenly jerked, eyes rolling back. The monitor screamed. Pressure is crashing, the nurse shouted. Emma was already back at his side. His skin had turned waxy. His breathing had slowed. His chest barely moved now. Pierce stepped in, voice controlled. We need to move him to a bay. Call thoracic. Emma shook her head once. He doesn't have time to travel. Pierce's eyes flashed. Carver, that procedure is not for you. Emma looked at him, and for the first time since she'd met him, her voice carried something like steel. He will be dead in 2 minutes. A resident nearby froze, caught between rules and the sound of the monitor climbing toward flat. Rosa's eyes darted from Pierce to Emma. She made a decision without asking permission. Needle now. A tech shoved the 14 gauge into Emma's hand. Emma cleaned the skin fast. Her fingers found the right space without searching. Second, intercostal midclavicular clean angle controlled depth. Pierce started to speak again. Emma didn't let him. Not with words. With action. The needle slid in. For a fraction of a second, there was nothing. Then air hissed out loud and sharp like a tire punctured in a silent room. The patient's chest rose. The monitor steadied. A number climbed back into safety. The entire trauma bay seemed to stop moving for a beat. Even the screaming from the hall softened as if the building itself had taken a breath. Rosa let out a sound that wasn't quite a laugh and wasn't quite a sob. Jesus. Emma didn't look up. Her hands stayed on the patient. Chest tube. Now. Secure the airway. Get him a portable X-ray after the tube is in. The resident beside her blinked hard, then sprang into motion, suddenly aware of what competence looked like when it had no room for doubt. Pierce stared at Emma's hands. Not at her face, not at her badge. Her hands. He stepped closer. Where did you learn to do that? Emma kept working. Her voice stayed steady. We need the tube. Pierce didn't move away. Answer me. Emma's throat tightened, but her hands did not slow. She took the scalpel for the chest tube incision, made a clean cut, and spread the tissue with a hemostat in a smooth, practiced motion. The respiratory therapist leaned in. Do you want sedation? Emma glanced at the monitor. He won't tolerate much. Small dose. Keep him breathing. The tube slid into the pleural space. A rush of air and fluid followed. The seal chamber bubbled. The patient's color improved by degrees, like the world was giving him back. Only then did Emma lift her eyes. Pierce's expression was not anger anymore. It was recalibration. Like a man watching a map redraw itself. You did that like you have done it 100 times, he said. Emma wiped sweat from her brow with her shoulder, careful not to break sterile field. We need to stabilize the rest. Pierce's voice lowered. What kind of training teaches triage like this? A stretcher slammed into the bay entrance, a patient coughing blood into an oxygen mask. Another alarm flared. A nurse yelled for more suction. Emma turned ready to move again. Ryan. Cade appeared at the edge of the bay, hair, disheveled, gloves half on, eyes wide. His swagger was gone. He looked like a man who had stepped into a storm and realized he had brought an umbrella. He watched Emma for a moment. His mouth opened as if he had a remark ready, something cutting something defensive. It didn't come out. Tessa Quinn slipped in behind him, already scanning patients. She caught Emma's eye briefly, and in that glance there was no judgment, only recognition. Like she had been right to doubt the idea of luck. Emma moved to the coughing patient. The man's ribs rose too hard, too fast. The mask fogged with each breath. Blood smeared across the clear plastic. Airway risk, Emma said. Suction. Prepare for intubation. The anesthesiologist rushed in. We can take him. Emma nodded. Tube him here. Don't transport unstable. The man gagged and coughed again, and a thick clot hit the mask. The room churned back into motion, but the space around Emma stayed strangely ordered. People followed her voice even when she didn't raise it. Even Pierce, for a moment, let her run the center of the storm. A nurse bumped Emma's elbow. Doctor, are you even a resident? Emma didn't answer. She adjusted the oxygen, checked the pulse, and kept moving. Pierce stayed close. His eyes never left her hands. Carver. Emma finally looked at him again, irritation flickering through the calm. Not anger, not panic, just the bare edge of being cornered. Where Pierce said, "Did you learn to make calls like this?" Emma opened her mouth to give him the safe answer. Simulation, rotations, study. But her body was still in the trauma bay. Her senses were still tuned to the sharp frequency of emergency. Her brain had no patience for the polished lie. The words slipped out before she could catch them. Quiet, blunt, unadorned. Forward unit, she said. Syria, 6 years. The bay went still again, not fully silent but hushed in that particular way rooms get, when everyone hears the same thing at once. Rosa's eyes widened. Tessa stopped moving for a heartbeat. Ryan's face drained of color. Pierce stared at Emma like the last piece of the puzzle had just clicked into place. Emma felt the air thicken behind her mask. She turned back to the patient in front of her and anchored herself to the work fingers, steady on the tubing zoids, steady on the orders, refusing to give the room anything else to read on her face. The hush did not last. It never did in an emergency department. A monitor alarm snapped the room back to motion, then another. Someone shouted for more suction. A stretcher bumped the bay door hard enough to rattle the frame. Emma turned back to the patient in front of her and gave the room what it needed most, something solid to follow. Pressure check. Her voice stayed even. Keep him warm. 2 units ready. Call respiratory back in. Rosa Delgado moved beside her, without a word, already placing warm blankets, already pushing a fresh bag of fluids. Tessa Quinn slipped into the next bay and started an exam the way Emma did. Quick hands, quiet eyes, no wasted questions. Ryan Cade stood frozen at the edge of the chaos for a moment longer, then forced his body to move like he belonged there. Emma kept working. She did not let herself think about what she had said. She did not let herself look at Pierce for too long. She stayed with pulses and breath sounds and the bright, blunt language of survival. By the time the last critical patient was wheeled toward imaging, the emergency department looked bruised. Blood stained the floor in thin arcs where gurney wheels had carried it. Empty packaging littered carts. Gloves lay in crumpled piles. The air felt heavy with used oxygen. A young resident leaned against the wall, hands shaking, eyes watery with adrenaline. He watched Emma secure a chest dressing with tape so smooth it looked practiced. "How do you stay like that?" he asked, barely audible. Emma did not answer. She pressed the tape down, then checked the patient's pulse one more time, as if the act itself was an answer. Pierce approached while the hallway quieted by degrees. His sleeves were rolled up, forearms wet from scrubbing. He had the look of a man who had watched his own system bend, then hold. "Carver," he said. Emma glanced up. Pierce's gaze was fixed, controlled. "Step out." Rosa pretended not to hear, but her eyes flicked toward Emma with a quick protective concern. Tessa looked up from charting and held Emma's gaze for a beat. Not sympathy, not curiosity. Something steadier. A recognition that Emma was about to walk into a different kind of trauma bay. Emma followed Pierce past the curtain lines, past the packed hallway, into a quieter side corridor where the sound of monitors softened. Pierce stopped near a supply closet and turned to face her. The fluorescent light above them buzzed faintly. "You said Syria," he began. Emma did not flinch. "We have patience. We have stabilized patience," Pierce corrected. His tone did not rise, but the edge sharpened. "You disclosed something in front of my staff." Emma kept her voice low. "I was answering your question." Pierce's eyes narrowed. "You were not answering. You were slipping." Emma's jaw tightened. She could feel her pulse in her throat, steady but strong. She tried to keep her posture neutral, the way she had learned to stand when someone with authority wanted her smaller. Pierce watched her hands again. They were still, but not relaxed. "Who knows?" he asked. Emma exhaled slowly. "Anyone in that bay who was listening." Pierce held the silence for a moment, then said, "Do not leave the department until I tell you." Emma nodded once and turned back toward the work. When she stepped into the main corridor, the air felt different. Not because the emergency department had changed, but because the eyes had. Nurses looked at her like they were seeing a new outline around an old shape. A trauma tech gave her a nod that carried respect, the kind earned in chaos. A paramedic paused, then spoke to her like she belonged in his world. "Good catch on that chest," he said quietly. "Most people hesitate." Emma kept walking. She did not slow. She did not answer. At the workstation, Ryan stood with his hands braced on the counter, staring down at a chart. When Emma approached, he looked up too quickly. So he said, voice too loud for the space, "Forward unit, huh?" Tessa's head lifted from her notes. Rosa glanced over without moving her feet. Emma opened a chart and began writing orders. Her pen moved with clean strokes. She acted like his words were just air. Ryan's smile was thin. "You know what this looks like, right? Like you hid experience to get in. Like you lied." Emma kept writing. "Get your patient's labs." Ryan leaned closer. "You think people are just going to clap for you? The attendings heard you. Pierce heard you. Admin will hear you." Tessa cut in calm but sharp. "Ryan, stop." Ryan turned his head toward her, offended. "Stop what asking questions? She's not who she said she was." Emma's pen paused for half a second. She did not look up. Rosa stepped closer, her voice flat. "He's alive," because she did not hesitate. Ryan scoffed, but it sounded weak. "That does not matter. Rules matter." Rosa's eyes stayed on him. "Rules matter until they kill people." Ryan swallowed, then tried again, softer, more poisonous. "If she left that off her application, it's a problem. You know it. She could get bounced." Emma finally looked up. Her gaze was steady, not angry, just tired. "I am busy." Ryan blinked, thrown by the lack of reaction. "That's it. That's all you have." Emma lowered her eyes back to the chart. "Go. Work." Ryan stared at her as if waiting for the fight he wanted. When it did not come, he turned away with a tight, frustrated motion. Tessa leaned closer, voice low enough that only Emma could hear. "He's scared." Emma did not look up. "He should be working." Tessa watched her write. "You did not do anything wrong in there." Emma's hand tightened around the pen. "It depends who you ask." A stretcher rolled by with a patient moaning softly. Emma pushed away from the counter and moved to the bedside, checking a dressing, adjusting the oxygen tubing. The simple work grounded her. Tape, pulse, breath, real things. Hours passed in uneven waves. The emergency department slowly returned to its usual tempo, the kind of busy that felt almost gentle after disaster. The last critical patient left for the intensive care unit. The hall cleared of extra staff. The smell of blood thinned under stronger disinfectant. Emma did not notice her own exhaustion until she stepped into the locker room and the door closed behind her. The silence hit like pressure. She stood for a moment with her back to the door, eyes on the tile floor. Her scrubs were stained. Dried blood marked her shoes. Her hair had escaped its tie and clung to her forehead. She turned on the sink and washed her hands. The water ran pink at first, then clear. She scrubbed anyway, as if the effort could remove more than blood. She washed up to her wrists. She washed under her nails. She washed until her skin felt tight. Her reflection stared back from the mirror, pale and composed, with eyes that looked older than the rest of her face. A memory flickered at the edge of her mind. Heat. Dust. Someone shouting in a language she had learned to understand by necessity. She blinked once hard and forced the image down. The locker room door opened. Pierce stepped inside and closed it behind him. He did not speak at first. He leaned against the wall, arms crossed, watching her the way he watched a surgical field. Emma turned off the water and dried her hands slowly. The towel was rough against her skin. "You saved 3 patients today," Pierce said. Emma looked at the towel in her hands. "The team saved them." Pierce's voice stayed steady. "You performed procedures we do not allow a first-year resident to perform." Emma met his eyes in the mirror. "They were dying." Pierce stepped closer. "And you did not hesitate." Emma set the towel down. Her hands were still damp. Pierce continued, quieter now. "I need you to tell me what you are. Not for gossip, not for punishment. Because I am responsible for you in this hospital. If something goes wrong, my name is the one that follows." Emma felt her chest tighten. She tried to keep her face neutral, but her throat burned. "I am a resident," she said. Pierce's expression hardened. "Do not insult me." Emma's fingers curled around the edge of the counter, just enough pressure to steady herself. Pierce held her gaze. "I watched you triage like you have done it in places where the consequences do not wait for consent forms. I watched you make a call on a collapsing chest without asking anyone's permission. That is not simulation." Emma took a slow breath. "You already know." "I know pieces," Pierce said. "I want the truth." Silence settled again, heavier than before. Emma looked down at her hands. They were steady. They always looked steady. "My name is Emma Carver," she said carefully. "That part is true." Pierce waited. Emma swallowed. The muscles in her neck tightened. "Captain Emma Carver." She corrected, voice barely above a whisper. "United States Army Medical Corps." Pierce did not blink. Emma forced the rest out clean and blunt because softness made it harder. "Trauma surgeon. 6 years." Pierce's shoulders eased by a fraction, not relief exactly, but confirmation. Like a diagnosis finally had a name. "Why hide it?" he asked. Emma stared at the floor for a beat, then looked back up. "Because it follows you. Because people do not see the doctor first. They see the uniform. They see the story they already decided about you." Pierce's eyes stayed on her. "And your application." Emma's jaw tightened. "I did not lie about my education. I did not claim training I did not have. I left out a chapter I did not want to live in every hallway." Pierce was silent for a moment, then said, "This hospital is not a battlefield." Emma's laugh came out without humor, a short breath. "No, it's worse sometimes. Here people pretend the worst does not happen." Pierce studied her, then looked away, as if weighing her words against what he had seen. "Were you discharged?" he asked. "Or did you leave?" Emma's fingers flexed once. "I left." Pierce nodded slowly, then reached into his pocket and pulled out his pager, checking it without really seeing it. "People are going to talk," he said. Emma's expression did not change. "They already are." Pierce's gaze returned to her direct. "I am going to ask you again, and you are going to answer like an adult physician. Is there anything in your past that affects patient care, your judgment, your ability to function in this hospital?" Emma felt the question press into places she kept locked. She chose honesty that did not open every door. "I can function," she said. "You saw that." Pierce held her gaze. "I did." A knock sounded on the locker room door, quick and hesitant. A resident's voice came through, muffled. "Dr. Pierce administration is asking for you." Pierce's eyes stayed on Emma. "Get changed," he said. "Then come to my office." Emma's stomach tightened. "Now." Pierce's tone was firm, controlled. "Now." He opened the door and stepped out, then paused long enough to add quieter. "Do not let anyone bait you. Not tonight." The door shut again. Emma stood alone for a beat, listening to the hallway noise return muted through the wall. She opened her locker, folded her stained scrubs with the same careful precision, and changed into a clean set. When she laced her shoes, her hands did not shake, but her chest felt tight the whole walk back upstairs. Emma reached Dr. Pierce's office with her heart still tight, the kind of tight that did not come from running. The hallway up here was quieter, carpeted, insulated from the sounds below. It felt like a different hospital, one built for decisions instead of blood. Pierce stood by his desk with a stack of papers in his hand. He did not offer a chair. Administration is waiting, he said. Emma kept her face neutral. For what? Pierce's eyes held hers. For answers. He led her out into the corridor again. The elevator ride was silent. When the doors opened, they stepped into a conference wing that smelled like toner and stale coffee. A frosted glass door read Executive Conference Room, and Emma could see silhouettes moving inside. Pierce pushed the door open. The room was bright, long table pitchers of water, a tray of untouched pastries. People sat with folders and tablets, their expressions composed in the careful way of people who believed calm made them safer. At the head of the table sat a woman in a navy blazer with a hospital badge that read, Karen Langley, Chief Operating Officer. Beside her was a man in a gray suit who looked like legal counsel. Another woman had a laptop open and a notepad full of neatly written lines, Human Resources. At the far end, a surgeon Emma recognized from Grand Rounds sat with arms crossed, the residency program director, watching like this was a case presentation. A seat near the wall was empty. Dr. Pierce Langley said, all politeness and control. Her eyes slid to Emma. Dr. Carver. Emma nodded once. Pierce did not sit. He stood behind the chair nearest Emma, a silent statement about who had brought her here. Langley folded her hands. We are here because there was an incident today involving scope of practice and disclosure. Emma kept her gaze steady. The emergency department was overwhelmed. That is understood, Langley said. Still, this hospital has protocols. The legal counsel spoke next. His voice was smooth, practiced. You performed a decompression procedure in the trauma bay. Emma did not deny it. The patient was crashing. And you are a first-year resident, he said, as if it were the primary diagnosis. Pierce stepped forward. She made a correct call. She bought time until the chest tube was placed. The man nodded as if he appreciated the clinical logic, then returned to the language of risk. We are not debating whether the patient improved. We are debating the rules that protect this institution. Emma felt her jaw tighten. She kept her voice calm. The rules did not protect him. The program director shifted slightly, eyes narrowing. Pierce's posture stayed still, but Emma could tell he had noticed the tone. Langley raised her hand, gentle but firm. Dr. Carver, we also have concerns about your application. Emma's stomach tightened again. My application? Human Resources glanced down at her notes. Your file did not include any mention of prior military service or advanced trauma credentials. Emma held her breath for a fraction of a second, then let it out slowly. My license is current. My medical school records are complete. That is not the question, the HR woman said. Pierce's gaze landed on the folder in his hand. He set it on the table and opened it with deliberate care, like he was exposing evidence. She did not falsify her education, Pierce said. She omitted a chapter of her history. Langley's eyes stayed on Emma. Why? Emma could feel the room waiting. This was not an operating room. No one here cared about the smell of infection or the sound of air leaving a collapsed chest. They cared about what could be documented, what could be blamed, what could be contained. Emma chose her words with care. Because I wanted to be trained as a resident, not treated as a story. The legal counsel tilted his head. Treated as a story. Emma looked at him. When people hear uniform, they stop seeing doctor. The program director finally spoke, voice cool. Your background could have been an asset to the program. Emma nodded once. It also becomes a label. People start watching for the label instead of the patient. Pierce kept his eyes on the table, but his presence at her back felt steady. Emma did not know if it was protection or control, but it helped her stand still. Langley's expression did not soften. A label does not justify non-disclosure. Pierce tapped the folder with 2 fingers. Then let us focus on the event that triggered this meeting, because the only reason we are sitting in this room is that she saved lives. Human Resources inhaled as if preparing to object, but Pierce continued before anyone could stop him. He slid a page across the table. Time to triage, he said. Time to intervention. Vital trends. Outcomes. The program director leaned forward and scanned the page. Langley did not touch it at first, then finally picked it up. The legal counsel read over her shoulder. Pierce's voice stayed controlled, but it had an edge that belonged in a trauma bay. 6 critical patients arrived within minutes. The emergency department was at capacity. Dr. Carver identified a tension pneumothorax and decompressed it immediately. That patient did not arrest. He went to intensive care with a pulse. Langley set the paper down. No one disputes that the patient survived. Pierce's eyes sharpened. You are saying the word survived like it is a footnote. The legal counsel held up his hand. Dr. Pierce, please. Pierce did not raise his voice. He did not need to. I will not watch administrators treat competence like a threat. The program director looked at Emma. Dr. Carver, did you have explicit authorization? Emma answered honestly. No. The legal counsel nodded as if that was the only sentence that mattered. Pierce stepped closer. The patient did not have explicit permission to die either. A quiet tension spread across the room. Langley stared at Pierce for a moment, then turned back to Emma. Are you currently enlisted? She asked. Emma shook her head. No. Are you on reserve status? No. Were you honorably discharged? Emma paused. A tiny pause, almost nothing, but Pierce noticed it. The program director noticed it too. I left, Emma said. My service ended. Langley nodded slowly, absorbing the lack of detail. Did you receive psychological clearance? Emma met her gaze. Yes. Human Resources leaned in. Do you have any conditions that could impact patient safety? Emma's hands stayed still at her sides. I can function. Today proved that. The HR woman looked down, wrote something, then looked up again. Functioning is not the same as being well. Pierce's voice cut in precise. Do not weaponize concern. She performed under pressure with better composure than most senior residents. Langley's tone remained even. We have liability, credentialing, public perception. Pierce did not move. We also have people alive who would not be alive if she had followed a rule written for a calmer day. The program director sat back and studied Emma. Did you omit your service because you feared rejection? Emma's throat tightened. I omitted it because I did not want it to be the only thing anyone saw. Silence settled again. A soft knock sounded at the door. Rosa Delgado stepped in, still in scrubs, hair pulled back, face tired, in the way only disaster makes people tired. She stopped when she saw the table full of suits and polished badges. Langley frowned. This meeting is closed. Pierce turned his head. I asked her to come. Rosa's eyes flicked to Emma, then back to Langley. You want to talk about protocol? Fine. I want to talk about what it looks like when someone hesitates in a trauma bay. Langley's lips pressed together. This is not a testimony hearing. Rosa moved to the empty seat near the wall and stayed standing beside it. You can call it whatever you want. I was there. Your policy was not on that stretcher. The legal counsel opened his mouth, but Rosa kept going, voice steady, not loud, just impossible to ignore. We had a man turning blue. His pressure was falling. The resident on duty froze for a second because he was waiting for the right person to say yes. Dr. Carver said yes with her hands. She did it clean. She did it fast. That man is in intensive care tonight instead of the morgue. Langley held Rosa's gaze. We are not suggesting Dr. Carver did not help. Rosa's eyes hardened. Then stop talking like she created a problem. The program director looked at Pierce, then at Emma, then at the papers on the table. His expression shifted into something more thoughtful, less reflexively defensive. Langley lifted her chin slightly. The omission remains. This hospital is a training environment. Pierce answered without hesitation. Then train around what she is. Do not punish it. Do not pretend it does not exist. The legal counsel spoke again, quieter now. If the story spreads that she concealed her background, it could be framed negatively. Pierce's eyes flashed. If the story spreads that her skill saved 6 families from a phone call they never wanted, that is also a story. Langley's fingers tapped once against the table. She looked at Emma. Dr. Carver, are you willing to place a formal disclosure on record? Emma nodded. Yes. Are you willing to undergo a competency review and supervision plan? Emma kept her voice level. If it keeps me in the hospital and keeps patients safe, yes. The HR woman wrote again. The program director watched Emma's face as if searching for defiance or instability and found neither. Langley exhaled slowly. Fine. We will implement an oversight plan. Dr. Pierce will be responsible for monitoring scope of practice. Pierce did not look relieved. He looked alert, like he understood the cost of being responsible for someone dangerous in the best way. Langley continued. There will be no disciplinary action today. However, the omission will be documented. Emma's chest loosened by a fraction, just enough to breathe. The legal counsel added, any further deviations from protocol will be reviewed immediately. Pierce's voice remained calm. Then make sure your protocols reflect real emergencies. Langley's gaze sharpened. This meeting is adjourned. Chairs shifted. Papers slid back into folders. The room returned to its controlled world where outcomes fit into columns. Rosa held Emma's gaze as people stood. You did good, she said quietly, then corrected herself. You did what needed doing. Emma nodded, grateful for the plainness. In the hallway outside, Pierce walked beside Emma in silence until they reached the elevator. The doors closed and the hum of the cable filled the space. Pierce spoke without looking at her. You wanted to hide. Emma kept her eyes forward. I wanted to work. Pierce turned his head slightly. After today, hiding is not an option. Emma swallowed. The hospital lights blurred for a moment behind her eyes. She steadied herself on breath and routine. Pierce continued, voice low, controlled. You want to stay invisible, or you want to lead? Because you cannot do both. Emma stared at the elevator numbers as they counted down. Her hands were still. Her throat burned. The doors opened to the emergency department floor. The smell of disinfectant rolled out sharp and familiar. The corridor was quieter now. Fewer stretchers, fewer raised voices. Only the steady pulse of machines and the distant sound of a mop bucket rolling. Emma stepped out. Pierce watched her for a beat, then turned away toward his own path. Emma walked back into the department, not rushing, not lingering. She passed empty bays where sheets had been replaced and monitors reset. She passed a cart stacked with new supplies as if the hospital could restore itself by rearranging objects. She stopped near the trauma bay where she had placed the needle earlier. The floor had been scrubbed clean, but her mind still heard the hiss of air. For a moment, an image tried to surface, heat and dust, and voices, a child's small hand slipping from hers. Emma closed her eyes tight and opened them again. She whispered, barely audible, maybe I am both. At the nurse's station, charts lay stacked. The work was waiting, unromantic and constant. Emma sat and tried to focus. Her pen hovered above the page, but the lines blurred. Footsteps approached. Pierce leaned against the counter, his presence quiet but immediate. He did not speak with his earlier edge. His voice was softer now, almost careful. One of the derailment patients is asking for you, he said. Emma's hand froze above the chart. Which patient? Pierce glanced at his notes. Evan Hale. Intensive care. Emma's pulse jumped sharp and sudden, as if her body recognized the name before her mind could place it. She stood slowly, pushing the chair back with a soft scrape, and followed Pierce toward the hall that led to the intensive care unit. The intensive care unit felt like a different planet. The air was colder, scrubbed clean to the point of sterility, yet it carried a faint tang of plastic and warmed saline. Machines breathed for people in soft, mechanical sighs. Curtains hung half-drawn like tired eyelids. Emma followed Pierce past glass doors and quiet nurses with quick footsteps past rooms lit in dim blues and greens until Pierce stopped at a door with a small sign that read 314. He did not open it right away. He is awake, Pierce said. Not fully himself yet, but alert. Emma stared at the room number as if it might change. The name had landed in her chest like a dropped weight. Evan Hale. A memory tried to rise bright and sharp. Sunlight on sand, a radio crackling, the taste of dust that never went away. Emma forced her breathing to slow. Pierce's eyes stayed on her face. Do you want me in there? Emma heard herself answer before she decided. Yes. Pierce nodded once and pushed the door open. The room was dim. A single overhead light glowed low. Evan lay against white sheets, pale under the blanket chest, wrapped and monitored. Tubes threaded from his body to machines that insisted on order. His face looked older than Emma remembered, though she could not place where she had last seen it. His hair was cropped short, his jaw unshaven, his eyes half-lidded. Then his gaze shifted to the doorway. It sharpened. His eyes found Emma, and something in his expression changed, like recognition hitting a fuse. "Doc," he rasped. The voice was raw, scraped by the tube that had been in his throat. It did not sound like a hospital patient's voice. It sounded like someone waking up from a place that never sleeps. Emma stepped closer, careful, measured. "Mr. Hale, you need to rest." His mouth twitched almost a smile, still using the same tone. Emma's throat tightened. "You know me." Evan's eyes flicked to Pierce, then back. "I do." Pierce's posture stiffened. "How?" Evan swallowed, winced. His hand shifted under the blanket slow. Emma watched it with a reflex she could not turn off. Hands told truth when mouths lied. Evan lifted his gaze again. "You still tape your gloves the same way." Emma felt her stomach drop. It was a small detail, a private habit, the kind that came from working where gloves tore and blood made everything slick. The kind you did without thinking, because thinking took too long. Emma kept her face still. "You are confused. You have been through a lot." Evan's eyes stayed steady on hers. "No, I am not confused." Pierce stepped in, voice controlled. "Evan, you are in intensive care. If you are delirious, we will call neuro." Evan's attention barely shifted. "She is Captain Carver." The room seemed to tighten. Even the ventilator in the next room sounded louder. Emma's heart thudded once hard. Pierce did not move. His eyes slid to Emma, then back to Evan. "You are certain?" Evan's mouth worked as if speaking cost him. "I watched her cut a chest open with a flashlight in her teeth. I watched her keep a man alive with one hand and a radio in the other." Emma's fingers curled around the bed rail. She loosened them slowly so no one would see the tremor. Pierce spoke again low. "Where?" Evan's eyes did not leave Emma. "Outside Al-Rahim, northern Syria." Emma's vision narrowed. The room, the IV line, the white sheets, all of it pulled back behind that name. Al-Rahim. Emma heard the sound first. Not a memory, but a sensation. The sudden deep thud that shook the ground. The ringing after. The rush of voices all at once. The taste of copper on her tongue. Her pulse climbed. She forced her voice to stay gentle. "You should not be talking." Evan breathed out slowly. His chest rose under the bandage. "I have been waiting for this." Pierce moved closer to the foot of the bed, arms at his sides, every inch of him alert. "Waiting for what?" Evan's eyes softened for a moment, then hardened again with effort. "For her to stop acting like she is a trainee who got lucky." Emma felt heat creep behind her eyes. She blinked once hard. "Stop." Evan's gaze held hers. "You saved me today." Emma swallowed. "That is my job." "You saved me then too." His voice cracked slightly. "You remember that day?" Emma did not answer. She could not. Pierce watched her as if watching a monitor trend. His expression changed subtle from suspicion to calculation. Evan turned his head slightly on the pillow. "They blamed you for Al-Rahim." Emma's breath caught. Pierce's eyes narrowed. Who blamed her? Evan closed his eyes for a second, then opened them again, as if he had to choose to stay here. Her chain of command. People who did not want her shining too bright. Emma's grip tightened again on the bed rail. She felt her knuckles whiten. She forced her hand to relax. Pierce spoke quiet but firm. "Evan, if you are making accusations, you need to be clear." Evan's mouth tightened. "I am clear." Emma heard her own voice thin. "You do not know what happened." Evan's eyes snapped back to her. "I do. Not all of it, but enough. And you deserve to know what you never got to know." Emma shook her head once. Evan's hand moved again under the blanket. This time, he slid it out slowly, fingers trembling with weakness. His wrist was bruised where IVs had been. His skin looked paper-thin under hospital light. He reached toward the bedside table, with effort, eyes never leaving Emma's face. The nurse call button sat there, a cup of iced chips, a folded piece of paper that looked out of place among the hospital items. Evan's fingertips touched it. He dragged it closer, inch by inch, as if every movement required permission from pain. Emma leaned in without thinking and steadied the paper so it would not fall. Evan let out a breath. Thank you. Emma froze at the automatic courtesy. It felt like a different world inside this room, a quiet pocket where the past could walk right in and sit down. Evan tapped the folded paper once. Open it. Pierce's voice sharpened. What is that? Evan's gaze flicked to him. Evidence. Emma stared at the paper. Her hands felt heavy. For a second, she wanted to step back. She wanted to let the nurse handle it. She wanted to leave the room and let the machines keep Evan alive without her. But Evan's eyes stayed on her steady and insistent. Emma unfolded the paper. A small flash drive slid out and landed in her palm with a soft click against her skin. Her stomach dropped again. Pierce leaned in, eyes narrowing. Where did you get that? Evan's voice rasped. I kept it. I was not supposed to. Emma looked at the flash drive as if it might burn her. This is not real. Evan's expression tightened. It is. Emma's mouth went dry. What is on it? Evan swallowed. His eyes glistened, though he did not cry. The warnings, the reports, the briefings that never made it to your unit. Emma felt the room sway. Not physically, but in her perception, like the foundation under her story had shifted. Her voice shook despite her effort. We did not have warnings. Evan's eyes held hers. You were told you did not. Pierce's gaze moved between them. Explain. Evan inhaled slowly. There were intercepted comms. There was a pattern. They knew the clinic was being used as a lure. They knew the timing, the routes, the window when the crowd would gather. It was written down. It was sent up the chain. Emma's chest tightened so hard it hurt. If they knew, then why were we there? Evan's eyes turned cold. Because you were there. Emma's head snapped up. What does that mean? Evan's voice grew sharper, the effort of speaking, pushing him through pain. You were getting noticed. A woman surgeon running trauma like it was nothing. You were pulling saves other teams could not touch. You were collecting commendations. You were becoming a problem for men who built their careers on being untouchable. Emma stared at him. The words did not fit. They did not belong in a hospital room with warm blankets and steady monitors. They belonged to that other world where ego and power killed people quietly. Evan continued. They wanted you humbled. They wanted you questioned. They wanted you to carry it. Emma felt a sting behind her eyes. She blinked again harder. No, that is not possible. Evan's mouth twisted. It is Doc. Pierce's voice was tight. Evan, you are saying people intentionally withheld actionable intel. Evan nodded once, slow. Yes. Emma's fingers closed around the flash drive so hard it hurt. Those kids. The words slipped out before she could stop them. Evan's expression softened in a way that made Emma's stomach twist. They were gone before they reached you. Emma flinched as if struck. No, she whispered. Evan's eyes held hers. You did not fail them. Emma shook her head, small, frantic. I held his hand. I was there. I could not stop the bleeding. I could not. Her voice cracked. She hated that it cracked. She hated the sound of weakness in this room. Evan swallowed hard. You did everything. You worked until your hands cramped. You kept going when your supplies ran out. You kept trying when the radio kept spitting orders that made no sense. You remember that. Emma's breath came faster, her vision blurred at the edges. Pierce stepped closer, his voice quieter. Emma. Emma did not look at him. She could not. Evan's voice dropped almost gentle. You carried it for years. I saw it in your eyes today. You were not just fast. You were punishing yourself. Emma's shoulders trembled once. She pressed her lips together until they hurt. Evan's gaze flicked to the bandage on his chest, then back. I have been holding on to this because I did not know if you would ever want it. Some people would rather keep the lie. It is simpler. Emma's voice was barely audible. Why tell me now? Evan's expression tightened with urgency. Because you are here. Because you saved me again. Because you are still trying to disappear. Emma looked down at the flash drive in her palm. It looked ordinary. Cheap plastic. Nothing that could hold the weight of years. And yet it did. She sank into the chair beside the bed, without realizing she had moved. Her hands shook now. small tremors she could not hide. She wrapped her fingers around the flash drive like a child clutching something precious. Pierce remained standing. His face was controlled, but his eyes were sharp with something new. Not suspicion, anger, maybe, or respect, or both. Emma stared at Evan. If this is true, then everything I have done to myself. Her voice broke again. Evan nodded slowly. Yes. Tears filled Emma's eyes. She tried to stop them. She failed. They slid down her cheeks, hot and silent. She did not wipe them away. Her hands were busy holding on to the only proof she had ever been offered. Pierce spoke softly. Do you want me to call someone? Emma shook her head, still staring at Evan. No. Evan's eyelids drooped. The effort was catching up to him. His breathing stayed steady, but his voice thinned. Take it. Look at it when you are ready. Emma nodded once small. Okay. Evan's eyes closed for a moment, then opened again. Do not let them take your hands from you. Emma's throat tightened. She wanted to answer. She could not find the words. Pierce stepped forward and adjusted the blanket gently, surprisingly careful. His voice was quiet. Get some rest. Evan's eyes closed again. His mouth relaxed. The fight drained out of him, leaving exhaustion. Emma stood slowly. Her legs felt unsteady. She kept the flash drive in her palm, hidden in her fist. Pierce walked her to the door. He paused with his hand on the handle and looked at her face. You believe him? Pierce said. Emma swallowed. Her voice came out low. I do not know what I believe, but I know what this feels like. Pierce nodded once. Bring it to me when you have seen it. Emma did not answer. She stepped into the ICU hallway. The lights seemed too bright. The quiet seemed too loud. She walked without rushing, without stopping. Fingers closed tight around a piece of plastic that suddenly weighed more than any scalpel she had ever held. Emma did not go back to the emergency department. She walked past it, past the steady beep of monitors and the smell of bleach, and climbed the stairwell 2 steps at a time until she reached a quiet landing between floors. The concrete wall felt cool against her shoulder when she leaned back and finally let her fist open. The flash drive sat in her palm like a small, ordinary thing. Cheap plastic. A sliver of metal. Nothing that should have the power to rearrange a life. Her breathing was still too fast. Emma pressed the drive into the pocket of her scrub top, right over her heart, as if keeping it close could keep it from disappearing. She stood there until her pulse slowed, and the noise in her head turned into something sharper. Not guilt. Anger. She went straight to Pierce. His office door was closed, but it was not locked. Emma knocked once and stepped in. Pierce looked up from his desk, a pen in his hand. Papers spread in front of him like he had been fighting a different kind of fire. He took one look at her face and stood. You saw him, Pierce said. Emma nodded. She did not sit. She crossed the room and placed the flash drive on his desk like evidence in a trial. Pierce stared at it for a beat. He gave you this. Emma swallowed. He says it has the warnings that never reached us. Pierce's jaw tightened, and you believe him. Emma's voice came out low. I believe he recognized me before I said a word. I believe he remembers things I never told anyone here. Pierce picked up the drive between 2 fingers and turned it slowly as if checking if it was a trick. If this is real, it is explosive. Emma's throat tightened. If it is real, I spent years tearing myself apart for nothing. Pierce's gaze lifted to hers. Not for nothing, but for a lie you were forced to carry. Emma looked away for a moment, eyes landing on the framed photo of a surgical team on his shelf. Clean scrubs, bright lights, smiling faces. She wondered how many of those people had ever had to hold a child's hand while they died. Pierce set the drive down. We will review it securely. Not on a hospital computer, not on your phone, not anywhere that leaves a trace. Emma nodded. The caution did not surprise her. Pierce treated information like a blade, useful and dangerous. He studied her again. How are you right now? Emma almost laughed. She did not. Functional. Pierce's eyes narrowed slightly. That is not what I asked. Emma forced herself to meet his gaze. I am angry. Pierce nodded once. Good. Anger can be clean. It can move with purpose. Emma's hands flexed. I do not want this to swallow me. Pierce's voice stayed steady. Then put it somewhere it belongs. He reached for a folder on his desk and slid it toward her. The label read, Harborline Trauma Response Unit. Emma stared at it. Pierce watched her. Administration agreed to an oversight plan. They also agreed to something else. Emma opened the folder slowly. Inside were memos, staffing notes, a proposal draft, and a schedule block titled Trauma Drills. The words looked strange on paper, like someone had taken an idea from her bloodstream and printed it. You did not ask me, Emma said. Pierce's expression did not change. I did not need to. I watched what happened in that emergency department. We are in Baltimore. We get shootings, collapses, highway pileups, industrial accidents. We pretend disaster is rare until it arrives. Emma looked down at the schedule. Weekly simulations. Cross-training with nursing and respiratory. A protocol update that included emergency decompression under defined conditions. Pierce leaned in slightly. You have a set of skills this hospital does not have. If you keep hiding them, they will rot. If you use them without structure, you will get crushed by the system. Emma held the folder, tighter knuckles whitening. And what do you want? Pierce's gaze stayed on her direct. I want you to lead this unit under my supervision. You train the team. You build the drills. You teach them to move before fear makes them slow. Emma's mouth went dry. The word lead landed differently than it had in the elevator. Back then, it felt like a trap. Now, it felt like a door. Emma stared at the papers. They are going to hate this. Pierce's mouth twitched. Some will. Some will be grateful. Either way, the patients will not care about their feelings. Emma let out a slow breath. Her anger sharpened into something that looked like clarity. Where do we start? Pierce pointed to the schedule. Tonight. There is an unused procedure room near the old outpatient wing. We begin there. The first drill was ugly. Not because the room was dirty, but because the people were raw. They stood in a loose circle, too many hands in pockets, too many eyes on the floor. A couple of residents showed up late and tried to pretend it was casual. 2 nurses arrived with arms crossed, skepticism written into the set of their shoulders. Respiratory came with equipment practical and quiet, ready for whatever would make their job easier in the next real emergency. Rosa Delgado arrived last, not apologizing, simply present. She gave Emma a nod, like a soldier acknowledging another soldier. No drama. No questions. Pierce stood by the doorway, arms folded, watching. Emma faced the group and felt a familiar pressure behind her ribs, the kind that came before action. She did not raise her voice. We are going to run scenarios, she said. We are going to make mistakes here, so we do not freeze out there. A resident lifted a hand halfway. Dr. Carver, are we being graded? Emma looked at him. If you mean judged, yes. If you mean punished, no. A nurse with a tight bun tilted her head. This is not the military. Emma nodded. No, it is a hospital. People still bleed. A few eyes shifted. A few mouths tightened. Someone in the back let out a small snort. Ryan Cade leaned against the wall with his arms crossed, trying to look amused. So this is your new thing. War games. Emma kept her gaze on the group, not on him. It is medicine. With time pressure. Ryan's smile widened. Time pressure is every day. Emma finally turned her head and looked at him. Her voice stayed calm. Then you should be good at it. A couple of people suppressed a reaction, not quite laughter, not quite relief. Emma stepped toward the mannequin on the gurney. Its plastic skin was pale and smooth. The monitors around it were real. Scenario 1, Emma said. Crush injury, declining oxygen, rising heart rate, falling pressure. She nodded at the resident who had asked about grading. Go. He hesitated, eyes darting to Pierce, then back to Emma. Airway. Check it, Emma said. He leaned in. He fumbled with the head tilt. His hands shook slightly. Emma did not grab the task from him. She watched, then spoke once. Use your palm, not your fingertips. You need control. He adjusted. It worked. The airway opened. The next resident came in too fast and started calling for imaging before anyone had a pulse check. Emma stopped him with a hand not touching, just halting the motion with presence. If you do not have a pulse, You do not have a CT. The resident blinked and corrected course. A respiratory therapist moved in, placed a mask, and asked bag or intubate. Emma looked at the vitals. Bag first. Buy time. Decide with data. The drill continued, messy but alive. People tripped over each other. Orders overlapped. Someone forgot to call for blood. Someone started an IV in the wrong place and then froze, embarrassed. Emma did not shame them. She reset the room and ran it again. By the third run, the noise got cleaner. Voices sharpened. Hands stopped shaking as much. The group started to move like a team instead of a crowd. Rosa watched and said quietly, "Now they are listening." Pierce said nothing, but his eyes stayed on Emma, alert and approving. After the drill, as people peeled off gloves and wiped sweat from their faces, a nurse approached Emma with a cautious expression. "I thought this was going to be a waste," the nurse admitted. Emma nodded. "Was it?" The nurse hesitated, then shook her head. "No, it was scary. But it made sense." Emma looked at the equipment laid out on the table. "Good. Keep coming back." The nurse left. Ryan lingered, arms still crossed, looking for the angle that would let him stay superior. "You know administration is going to hate the optics of this," he said. Emma kept packing supplies into bins. Optics did not decompress that chest. Ryan's eyes narrowed. "You are not in charge here." Emma snapped the lid on a bin, neat and controlled. "Neither are you." Ryan's jaw clenched. He walked off, shoes too loud against the tile, leaving behind a sour tension that did not dissipate. Later that week, the unit had its first real test. Not a derailment, not a spectacle, but a single patient brought in by EMS from a highway shoulder. A man in his early 30s, tattoos on his forearms, a veteran's haircut, and a piece of shrapnel lodged where no piece of metal belonged. The CT showed it sitting dangerously close to the pericardium, a thin margin between stable and catastrophic. The case landed on Pierce's service, the operating room filled with experienced staff and a few observers who had heard about the drills. Tessa stood on the opposite side of the table, eyes focused, hands steady. Rosa was not scrubbed in, but she stood by the door in case the case turned into a sprint. Emma scrubbed at the sink with the same slow precision, but her mind felt different. The flash drive sat locked in Pierce's safe now. The knowledge of it burned behind her eyes. It did not distract her. It sharpened her. Inside the room, the patient lay draped and still, the monitor tracing a fragile stability. Anesthesia called out vitals. The scrub tech laid instruments out in clean order. Pierce entered and gave Emma a single look that carried both authority and trust. "Dr. Carver," he said, "you are first assist." Emma nodded. "Understood." The incision began, controlled and careful. Tissue parted. The field opened. The shrapnel was deeper than the image suggested, nestled near vessels that did not forgive mistakes. A resident on the periphery whispered, "That is close." Tessa glanced at Emma, eyes wide but steady. Emma did not answer with words. She adjusted the retractor a fraction, and the view improved. The artery pulsed close enough to feel in the air. Pierce worked with calm precision. Emma mirrored him. Suction placed exactly where blood would pool. Clamp ready before it was asked for. A hand on tissue to stabilize without crushing. The room stayed quiet, the kind of quiet that meant everyone was paying attention. Then the fragment shifted. Not much, a millimeter. But the monitor reacted as if it had been an earthquake. The patient's heart rate spiked. Blood pressure dipped. An alarm chirped. A junior resident stiffened. "He is crashing." Pierce's eyes did not leave the field. Suction. Emma already had it there. Retractor, Pierce said. Emma placed it. The fragment threatened the thin membrane around the heart. A wrong move would turn this into a flood. Emma felt her own breathing slow, not because she forced it, but because her body understood this pressure. Her hands did not tremble. They did not rush. "Hold the line," she said, not loud, just clear. Tessa shifted her grip stronger. "Holding." Pierce's voice stayed steady. "We take it out clean. We do not chase it." Emma nodded, eyes on the fragment. She adjusted the angle of the forceps and used the smallest amount of pressure needed to secure it. The monitor continued to complain. Emma felt sweat gather at her hairline. She did not wipe it away. Pierce looked at her hand position for half a second, then followed her lead. Together, they eased the fragment free, slow as a sunrise, and the field stayed dry. The monitor steadied. The alarm stopped. A collective breath moved through the room. Not celebration, not relief, just the permission to keep going. The case finished without drama after that closing clean sutures neat. Emma's knots held flat and sure. When the drapes came down and the patient was wheeled out, Pierce peeled off his gloves and looked at Emma. "That was good work," he said. Emma nodded once. The praise did not land like comfort. It landed like responsibility. Outside the operating room in the corridor, where people always seemed to hover when they wanted to see competence up close, a couple of residents watched Emma pass with a different expression than before. Less suspicion, more hunger. The kind that said, "Teach me." Tessa fell into step beside her. "That fragment," she said quietly. "You did not flinch." Emma kept walking. "Flinching wastes time." Tessa studied her profile. "You are changing." Emma's hand brushed the pocket where her badge clipped. She could still feel the phantom weight of the flash drive, even though it was not on her anymore. "I am tired of pretending," Emma said. They reached the workroom. Charts waited. Pages of numbers, ordinary problems, ordinary pain. Emma sat down and opened the next file. Her pen hovered for a moment, then moved. In the doorway, Pierce paused and watched her write, not like an administrator counting risk, but like a surgeon watching a new kind of tool become part of the set. By the time Harbor Line settled back into its normal rhythm, the hospital had started to feel the ripple of what had happened. Not in applause, not in speeches, in smaller ways. A respiratory therapist began setting up airway trays before anyone asked. Nurses started calling out vitals with a sharper cadence. Residents who used to hide behind confidence began asking quieter, better questions. Emma's trauma drills filled the procedure room twice a week, and the people who showed up early were no longer just the anxious ones. They were the smart ones. Emma kept her head down and worked. She rounded in the mornings, assisted in the operating room, ran drills in the afternoons, and wrote notes late into the night. When she walked through the emergency department, she felt eyes on her, but fewer of them carried suspicion now. More of them carried something closer to relief. On a Wednesday afternoon, Emma was standing at the whiteboard with Tessa and Rosa, mapping out a new intake flow, when Pierce appeared at the edge of the room. He did not interrupt. He waited until Emma set the marker down. "Carver," he said. Emma turned. "There is someone here to see you," Pierce added. His voice stayed even, but his eyes had that tight focus Emma recognized from the moment a case turned complicated. "Official. Federal." Rosa's posture stiffened. Tessa's gaze flicked to Emma's face, searching for a crack. Emma kept her expression steady. "Here. In the hospital." Pierce nodded. "Upstairs. Administrative wing." Emma felt the air change in her lungs. The memory of the flash drive sat like a stone under her ribs. Pierce had reviewed it with her in his office on a secure system, quiet and methodical. He had not reacted with theatrics. He had reacted with a surgeon's anger, controlled and sharp, the kind that gets clean when it has somewhere to go. Emma followed him without speaking. The administrative corridor looked polished in a way that always made Emma uncomfortable. Carpet without stains. Walls without scuffs. A silence padded by money. Pierce led her into a small conference room with glass walls and a view of the atrium below. A woman stood near the window, her back straight, shoulders squared, hands clasped behind her. Her uniform was crisp, not ceremonial, but precise. She turned as soon as the door clicked. Her hair was pulled back tight. Her face carried authority without needing volume. "Captain Dana Kincaid," she said, and extended her hand. Emma took it. The grip was firm, professional, practiced. Kincaid's eyes stayed on Emma's. "Dr. Emma Carver." Emma's throat tightened. "That is correct." Pierce remained by the door, arms folded. He did not introduce himself. He did not need to. Kincaid's gaze flicked to him briefly, then returned to Emma. "I am with Defense Medical Operations," Kincaid said. "I am here regarding the Al-Rahim incident." The room seemed to lose a degree of warmth. Emma kept her face still. "That was years ago." Kincaid nodded once. "It was. It has also been reopened." Pierce's jaw tightened. Emma could feel his focus beside her like a steady weight. Kincaid moved to the table and placed a folder down with controlled care, as if she knew paper could cut. "There has been an investigation," she said. It accelerated after a set of documents surfaced. Emma's fingers curled slightly, then relaxed. She did not need Kincaid to say flash drive. She could see it in the way the woman chose her words. Kincaid continued, voice even. "The findings are confirmed. The intel regarding the clinic was withheld. Warnings were delayed. Routing was altered. The result was predictable, and it was preventable." Emma's breath caught. She forced air back into her lungs. Pierce spoke for the first time. Who was responsible? Kincaid's gaze shifted to him, respectful, measured. "Several officers in the operational chain. The proceedings concluded last week." Emma's stomach tightened. Concluded. Kincaid nodded. 3 were dismissed. 1 received a prison sentence. Another faces additional charges pending review. Emma stared at the folder as if it might move on its own. Her mind tried to reach for the old shape of guilt, the familiar weight she had carried so long it felt like bone. It did not fit anymore. The space it left behind felt raw. "Why come here?" Emma asked, voice quiet. "Why now?" Kincaid's expression did not soften, but it grew more human around the eyes. "Because you were harmed. Professionally. Personally. And because your current work has drawn attention." Emma let out a breath she did not know she was holding. "My work." Kincaid nodded toward the window. From here, the atrium below looked small. People moved like a slow stream. No one down there knew that a few sentences in this room could rearrange Emma's life again. Kincaid placed both hands on the folder. "You are owed an apology. You are also owed something more practical." She slid the folder across the table toward Emma. Emma did not touch it immediately. Pierce's eyes stayed on Emma's hands the same way he watched them in surgery, waiting to see if they shook. Kincaid spoke again, precise. "Full reinstatement. Rank restoration. A command position within an advanced combat medical division. Your choice of assignment. Your choice of staff. Operational autonomy." The words landed like a door opening to a room Emma had locked and tried to forget. Emma finally reached forward and opened the folder. Inside was her name. Not just Dr. Emma Carver. Captain Emma Carver. It was printed cleanly, formally, in a format she remembered too well. The ink looked too crisp for something that was supposed to be dead. Her fingers hovered over the page. For a moment, she could almost smell dust and diesel again. She could almost hear the crackle of radios. She could almost feel the weight of her old vest on her shoulders. Pierce remained still behind her silent support, or silent witness. Emma could not tell which. Maybe both. Kincaid watched Emma's face. "This division will focus on rapid deployment trauma care and cross-training with civilian centers. It has funding. It has political backing. It has a mandate." Emma swallowed. A mandate to do what? Kincaid's voice stayed steady. "To prevent the kind of failure that happened at Al-Rahim. To build systems that do not depend on one person being heroic." Emma looked down at the page again. She saw her rank. She saw the signature lines. She saw a version of her life that had been paused, then offered back like a returned item. Her voice came out low. "You said I was owed an apology." Kincaid nodded. "You are." Emma let out a small breath that almost sounded like a laugh, but did not. "Apologies do not bring back the dead." Kincaid's eyes did not flinch. "No, they do not." Pierce shifted slightly by the door. Emma felt it the way you feel a change in air pressure. Kincaid continued, careful. "You also have a civilian impact now. What you built in Baltimore, your drills, your outcomes, the speed of your trauma response, that is being discussed." Emma's fingers tightened on the folder. "By who?" Kincaid's mouth tightened, then relaxed. "Hospitals. Military liaisons. Policy people who only care once they can attach numbers to a life." Emma looked past Kincaid to the window. She pictured Rosa in the emergency department, sleeves rolled up, refusing to let fear decide. She pictured Tessa, eyes sharp, absorbing every correction and turning it into competence. She pictured the residents in the drill room, less proud, now more capable. She pictured Evan in room 314, eyes heavy, hand trembling as he pushed the truth into her palm. Emma's throat tightened. "If I say no." Kincaid did not hesitate. "Then you stay here." And you keep doing what you are doing, with our support as partners where possible. Emma's gaze snapped back. Partners. Kincaid nodded. Training exchanges, protocol sharing, funding pathways. You would not be alone. Pierce's voice cut in quiet but firm. This hospital will support her. We already agreed to resource expansion for the unit. Kincaid met Pierce's eyes for a beat. I have read the internal reports. Your system flexed. It did not break. Pierce did not smile. It almost did. Kincaid returned her attention to Emma. You have options, Dr. Carver. Emma stared down at the folder again. Her mind tried to measure two versions of her life, like two surgical plans. Both had risk. Both had consequence. One came with uniform and hierarchy. One came with bureaucracy and politics of a different flavor. Neither promised peace. Emma forced her voice steady. Is this really about making it right? Kincaid held her gaze. It is about accountability. It is also about capacity. You are useful. The bluntness startled Emma more than any polite speech would have. It felt oddly honest. Pierce's eyes flicked to Emma, then away, as if he understood that honesty could still bruise. Emma nodded slowly. I appreciate the directness. Kincaid's tone softened by a fraction. You do not have to decide in this moment. Emma looked up sharply. Kincaid added, You do have to understand that this offer will not sit on a table forever. Nothing in our world does. Emma closed the folder halfway, then stopped, fingers resting on the page like a pause button. Pierce spoke quietly, Emma. It was the first time he had used her first name, without pressure behind it. It made the room feel more real, less procedural. Emma did not look at him. I know. Kincaid watched her with a measured patience. Whatever you choose, the record is corrected. You were not at fault. The findings are formal, documented. No more whispers. No more convenient scapegoat. Emma's chest tightened again, but this time, the tightness carried something like relief threaded with grief. She had spent years building a wall out of blame because it was the only way to make the past feel orderly. Now the wall had a door in it, and she didn't know what would rush through once she opened it. Emma set the folder flat on the table, palms resting lightly on either side as if anchoring herself. Why did you become the one to deliver this? Emma asked. Kincaid's eyes held hers. Because I have seen what happens when we let capable people get crushed by politics. Because I am tired of watching institutions protect themselves before they protect patients. Pierce's gaze sharpened at that. He did not object. Emma let out a slow breath. I built something here. Kincaid nodded. I can see that. Emma's eyes drifted to the glass wall again. Down below, a family in the atrium sat close together, heads bowed over a phone. A nurse walked past them and touched a shoulder gently. Life went on in 1,000 small motions. Emma looked back at Kincaid. If I take this, I am not interested in medals. Kincaid's mouth twitched, almost a smile. Good. Medals are not the point. Emma tapped the folder lightly once, as if testing its reality. And if I do not? Kincaid's voice stayed calm. Then you stay. You keep saving people. You keep teaching. And you let the record stand as it should have stood years ago. Emma's fingers tightened, then loosened. Pierce shifted closer, not touching her, just present in the way he had been during the shrapnel case. Steady pressure at her back. Emma took the folder and closed it fully. The sound was soft, final, a simple motion that felt heavier than it should have. She held it against her palm for a beat, then set it down again. I need time, Emma said. Kincaid nodded once. Take it. Emma stood. Her legs felt steady, but her chest still carried that raw space where guilt used to live. Pierce opened the door for her without speaking. As Emma stepped into the corridor, she glanced back once. Kincaid remained by the table, posture, calm eyes, attentive. The folder sat in the center of the room, like a waiting instrument. Emma walked back toward the elevator, with Pierce beside her. Neither of them spoke. When the doors opened onto the clinical floors, the smell of disinfectant met her again, sharp and familiar. A page sounded somewhere down the hall. A cart rolled past. Ordinary life, constant and unromantic. Emma tightened her grip on her badge clip for a moment, then let it go. She did not look down at her hands. She looked forward toward the sounds of the hospital that had become hers. Emma did not sleep that night. She sat at a workstation near the ICU with a stack of charts and a cup of coffee that had gone cold hours ago. The hospital after midnight had a different sound. Softer footsteps, fewer voices, the same machines still insisting on rhythm. The closed folder from Captain Kincaid sat in her mind like a weight she could not set down. Pierce found her there, just before 2 in the morning. He did not ask if she was okay. He looked at her face, then at the way her pen hovered above the page without moving. "You do not have to decide tonight," he said. Emma stared at the chart. "If I do not decide, it decides for me." Pierce leaned against the counter. "That is one way to look at it." Emma finally wrote the next line, slow and deliberate. "I built something here. It is small, but it is real." Pierce's eyes stayed on her. "It is not small." Emma gave a short breath that might have been a laugh if she had any room for it. "It is not enough." Pierce nodded once. "Then make it enough." Emma turned her head slightly. "That is what you want." "That is what the hospital needs," Pierce said. Then he added quieter, "That is what you need too." Emma set her pen down and stood. Her legs felt steady, but her chest still carried that raw space Evan had opened. She walked down the ICU hallway without rushing, stopping at room 314. Evan Hale lay with his eyes open, staring at the ceiling like he was listening to something no one else could hear. When Emma stepped in, his gaze slid to her face and focused. "You look like you are in a fight," he rasped. Emma pulled the chair closer and sat. "I am." Evan's mouth tightened. "With who?" Emma glanced down at her hands. "With myself." Evan watched her for a long beat. "They came." Emma nodded once. A captain, a folder, an apology that was stamped and signed. Evan closed his eyes for a second, then opened them again, and Emma swallowed. "And they offered me my rank back." Evan's gaze stayed steady. "Do you want it?" Emma's answer took a moment to find its shape. "I wanted it for a long time. I wanted the record to be clean." "It is clean," Evan said. "Now the question is what you do with clean." Emma leaned back in the chair. The ICU light made everything look sharper than it was. "If I go back, I know that world. I know how it works." Evan's voice stayed rough. "And if you stay." Emma looked toward the doorway, toward the hall, where nurses moved quietly toward the place where people came when their lives broke in ordinary ways. "If I stay," she said, "I can keep building this unit. I can keep training people who do not have 6 years of experience to borrow." Evan's eyes softened. "That is the part they cannot manufacture." Emma's throat tightened. "I am tired of being turned into a weapon." Evan nodded. "Then do not be their weapon. Be your own." Emma sat in silence for a moment. She could hear his monitor. It was steady. That steadiness felt like permission. Evan shifted slightly, wincing. "You are not running anymore." Emma looked at him. "No." Evan's mouth twitched. "Good." Emma stood and adjusted his blanket with a gentle motion that surprised even her. "Rest." Evan's eyelids lowered. "You too, Doc." Emma stepped out and walked until she found the hospital chapel. It was empty lights, low-stained glass, dark in the night. She sat in the back row, hands folded in her lap, and let the quiet press against her. She did not pray. She did not ask for peace. She listened to her own breathing and let the anger settle into something usable. When she stood again, the decision felt less like a leap and more like an incision. Clean. Intentional. By 8 the next morning, Captain Kincaid was back in the same glass room, folder closed, posture unchanged. Pierce stood beside Emma, silent, present. Kincaid looked up as Emma entered. "Dr. Carver." Emma walked to the table and rested her fingertips on the folder. She did not open it. "I read it," Emma said. Kincaid nodded, and Emma met her eyes. "I am grateful. For the record being corrected. For the people responsible being held accountable." Kincaid's expression stayed composed. "That is the minimum." Emma's voice stayed steady. "I am not taking the command." A quiet beat. Kincaid did not react with surprise. She reacted with evaluation, as if she had expected this answer and wanted to see how Emma would say it. "Why?" Kincaid asked. Emma placed her palm flat on the table, anchoring herself. "Because the work I am doing here matters. Because I have a team here that is learning to move faster, cleaner. Because I can build something that lasts even after I am gone. Kincaid's gaze flicked briefly to Pierce, then back. You think you can do that in a civilian hospital? I already am, Emma said. Kincaid studied her face. You understand what you are refusing? Emma nodded. I do. Kincaid's expression softened by a fraction barely visible. Then tell me what you want instead. Emma had expected that question. She had carried it in her chest all night. I want partnership, Emma said. Not ownership. I want the training exchange. I want access to updated trauma protocols. I want a liaison who can speak both languages without turning this unit into a billboard. Kincaid held her gaze. That is a lot to ask. Emma's eyes did not flinch. So was the life I lived. Pierce's jaw tightened with a quiet satisfaction. Kincaid let out a slow breath. You would rather build from the outside. Emma nodded, yes. Kincaid placed her hand on the folder and slid it back toward herself. Then we will do it your way. Emma's shoulders loosened by a fraction, not relief exactly, but alignment. Like a joint clicking back into place. Kincaid stood. Emma stood with her. Kincaid's hand rose in a crisp salute. Emma returned it without thinking, muscle memory clean and instant. Kincaid lowered her hand. You will have a liaison within 2 weeks. Emma nodded. Thank you. Kincaid paused at the door, gaze returning to Emma's face. For what it is worth, you were never the problem. Emma felt her throat tighten. She did not look away. I know. After Kincaid left, Pierce remained still for a moment as if listening to the silence settle. You chose, he said. Emma exhaled, yes. Pierce's voice stayed calm. Good. Now we work. The hospital board did not throw a celebration. They did not hold a press conference. They did what institutions did when they had been embarrassed by reality. They adapted. 2 days later, Karen Langley called a meeting with Pierce Rosa, the program director, and Emma. The same bright room, the same water pitchers. This time, fewer sharp edges. Langley slid a document across the table. Harbor Line Trauma Response Unit will become a formal program. Staffed. Funded. Protocols updated. Emma scanned the page. Training hours. Equipment budget. A dedicated space near the emergency department. Simulation support. Langley tapped one line. Clinical lead. Emma looked up. Langley's expression held controlled neutrality, but there was something else behind it now, something like respect that did not want to be seen as emotion. Dr. Carver. Emma did not smile. She nodded once. Understood. Ryan Cade did not like it. He made that clear in small ways at first, a too loud sigh during drills, a joke that fell flat, a comment about the hospital turning into a boot camp. Emma did not meet him with confrontation. She met him with work. On a Friday afternoon, Ryan arrived late to a drill and tried to slip into the back. Emma paused the scenario and looked at him. You are on airway, she said. Ryan blinked. I just got here. Emma's voice stayed calm. Then you will learn to catch up. Tessa handed him a bag valve mask, without pity. Ryan fumbled at first. His hands shook when the timer started. He looked toward Pierce as if hoping for rescue. Pierce did not move. Emma watched Ryan's technique, then said one sentence, quiet and precise. Seal the mask with your thumb and index. Use your palm to lift the jaw. Do not crush the face. Ryan adjusted. The chest rose. The monitor tone changed. Ryan's eyes widened, not with pride, but with something closer to understanding. After the drill, he lingered by the sink while Emma wiped down equipment. He cleared his throat like it hurt. I did not think it mattered, he said. Emma did not look up. That is why you froze in the bay. Ryan's face tightened. I did not freeze. Tessa glanced over. Rosa raised an eyebrow. Emma finally met Ryan's eyes. Her voice stayed even. You hesitated. It happens. You can either pretend it did not, or you can fix it. Ryan held her gaze for a beat, then nodded once. No apology, no speech, just a nod that admitted reality. That was enough. Late one evening, Emma was called to room 508. Lieutenant Maya Wilson lay propped up in bed, a young Army medic with a cast on her forearm and bruises that had faded from purple to yellow. Her eyes were too awake for a patient who should have been resting. When Emma walked in, Wilson's hands tightened on the blanket. "Dr. Carver," Wilson said, voice thin. "Can I ask you something?" Emma pulled a chair closer. "Yes." Wilson swallowed. "Do you think I will ever be able to do it again?" Emma watched the way the question sat in her mouth like a stone. "Do what?" "Be useful," Wilson whispered. "Every time I close my eyes, I see the one I lost." I freeze. Emma felt the words hit a familiar place. She leaned forward slightly. "You will do it again." Wilson's eyes filled. "How do you know?" Emma's voice softened. "Because freezing is not who you are. It is what your body does when it is trying to keep you alive. We train past it. We breathe through it. We do not pretend it is not there." Wilson blinked hard. "Is that what you did?" Emma held her gaze. "I tried to bury it for a long time. It did not work." Wilson's lips trembled. "So what works?" Emma placed her hand lightly on the bed rail, not touching Wilson, just close. "Doing the next right thing, then doing it again." Wilson nodded, tears slipping down her cheeks. Emma stood. "Rest. You will have drills if you want them when you are cleared." Wilson let out a shaky breath. "Thank you." Emma nodded and left the room. The next night, the emergency department called a trauma alert. A shooting 2 blocks from the harbor. A civilian caught in the wrong place at the wrong time. A teenager, pale, gasping blood soaking through gauze. Emma entered the trauma bay, and the room tightened, then steadied. Rosa was already there, sleeves rolled up. Tessa stood at the bedside, eyes sharp. Ryan was on the opposite side with gloves on, posture, stiff, trying not to show fear. Emma looked at the monitor, looked at the wound, looked at the patient's face. "Pressure is falling," the nurse called. Emma's voice cut through the noise, calm and clear. 2 large-bore IVs. Blood now. Ultrasound at the bedside. "Airway ready." Ryan's hands hovered. Emma glanced at him. "Airway." Ryan swallowed, then moved, sealing the mask properly, lifting the jaw, the way Emma had shown him. The chest rose. The oxygen climbed. Emma did not praise him. She simply nodded once and kept working. The ultrasound showed fluid where it should not be. "Or," Emma said. Pierce entered the bay as they rolled the gurney out, his presence. Steady eyes, scanning. He fell into step beside Emma without taking control away from her. In the operating room under the bright lights, Emma's hands moved the way they always had. Quiet, exact, unhurried. The bleeding vessel was found, controlled, repaired. The patient's pressure climbed back into safety. When the last suture was placed and the drapes came down, Pierce peeled off his gloves and watched Emma for a long moment. Sweat shone at her hairline. Her eyes were tired but steady. He spoke softly, almost to himself. "Those hands are not normal." Emma looked up at him. For the first time, she did not feel cornered by the sentence. She answered just as quietly. "They do not need to be." Outside the OR, the hallway lights felt gentler. The hospital smelled like disinfectant and hope that did not announce itself. Emma walked back toward the emergency department badge, swinging lightly against her coat. The unit was no longer a rumor. It was a shape in the building, a rhythm in the staff, a steadiness in the bay. And Emma did not try to shrink inside it. If you are still here, comment the city you are watching from. I love seeing how far these stories travel. And if you want more stories like this, hit like, subscribe, and turn on notifications so you do not miss the next one.